How do you evaluate the reform which the Ministry of Healthcare of Ukraine is implementing?
The Ministry of Health team has developed a lot of further conceptual documents, legislation, decrees, regulatory documents to implement the National Health Service, primary healthcare reform, reform in public health and medicines. And we see how the discussions are happening in Ukraine. And there are some really interesting moments. One of them is that there is so much discussion, real live discussion, involvement of different expert groups, NGOs.
Ukraine has some problems with communication between the Ministry of Healthcare, the Parliament and the relevant committees. Do you see this as a risk to reform?
It's really important for the Ministry of Health to work together with the government, different branches of the government, with civil society and also with Parliament. We think that this is a particular moment, a special opportunity in Ukraine when the whole country needs to come together, including the Parliament, and make these health reforms happen, because not doing anything is not an option anymore. We know that there have been various efforts, mostly at the local level, but I believe that a national transformation did not take place until now. We in fact call on the Parliament to pass this very important health financing reform, and ourselves we are ready to support its implementation.
The Ministry of Healthcare plans to set up a national agency which will control the provision of medical services. How will this work and who will control it?
This agency will be called the National Health Service, and the main function of this agency is to purchase healthcare services, to make contracts between this agency and healthcare providers, hospitals, primary healthcare providers. Such agencies exist in almost every country. And the reason why most countries establish such agencies is because this purchasing function is very complex. It requires some specialized skills. So such an agency is really the building block of a modern health system, and it's very difficult to provide good quality healthcare services without a purchasing agency. The National Health Service will function as a so-called executive agency, so it will be autonomous in its operational modality and implementation, but it is very strongly subordinated to the Cabinet of Ministers. The Ministry of Health will be the one creating the policies, and this agency will be implementing it together with the Ministry of Health.
Ukraine is implementing the approach of patients before money. The Ministry of Health calculates that it can allocate around $8 per patient. Is this considered a large or small sum of money?
Today, if we look at primary healthcare spending, it comes out to be about 150 hryvnia per person. So compared to this is quite a significant increase to move even to 200 hryvnias per person. The second aspect is that these calculations are not yet final, so the Ministry of Health is refining these calculations. So this number could be a different number when we come to the final, but it's clearly going to be an increase compared to what primary health care is receiving today. The third aspect to consider is that today Ukraine is a very difficult economic situation. And one final point, there is a lot of money spent in the Ukrainian health system not well spent. It's spent on interventions or medicines that are not improving the health of the people. It's spent for the maintenance of infrastructures that don't produce much benefit for the people. So we can spend the money we have much better for the benefit of the people, and this new system will allow you to do that.
The system began operation at the beginning of April. How effective is it as an instrument for fighting corruption in the field of healthcare?
I will be honest with you, this is not an easy program to implement, but I think with good communication efforts and with good people, it's absolutely possible, because it is the patient who is in the center of this program. The patient decides which doctor he goes to or she goes to. The doctor prescribes a medicine. The patient decides then which pharmacy they want to go to, where they have good experience to get this medicine. And then there is a direct reimbursement to the pharmacy for this medicine. So it's all about the patient, the choice of the patient chooses the doctor, the patient chooses the pharmacy, and the money actually just goes to this pharmacy in an indirect route and the patient doesn't need to worry about it. This is the system of medicine benefits practiced in most European countries.